One of the scariest things about the Wuhan coronavirus, one of the many reasons all of us have long been so afraid of it, has always been how little we know about it. Ebola, malaria, cholera, obviously those are dangerous diseases. They've killed millions. But on the whole, we understand them pretty well, the fundamentals anyway. We know how easily they spread. We know how deadly they are. This disease, by contrast, is entirely new. It's literally a novel coronavirus. Early accounts said the mystery illness coming from central China could be transmitted far more easily than the flu, and that the death rate was remarkably high. Some reports suggested it could kill 2, 3, 5, even 8% of all dying in this pandemic, including here in the United States. Beyond that fact, we still don't have the numbers we need to fully understand what's happening around us. Too few people have been tested. And yet, as of tonight, there are some suggestions of good news. We want to bring them to you. Here's one. Between March 22nd and April 4th, a total of 215 pregnant women delivered babies at New York Presbyterian Allen Hospital and Columbia University Irving Medical Center. Every single one of these women was screened for the coronavirus. It turned out that 33 of them had it. That's more than 15% of the total group. Of the infected, 29 of them, that's about 88% of them, were totally asymptomatic. So think about what that might mean if we extrapolated it citywide. As of April 4th, New York had more than 60,000 confirmed cases of the coronavirus and a little over 2,200 deaths. If more than 15% of New York's population was infected, that would suggest a total of 1.3 million cases in New York, with only about 150,000 of them showing symptoms. In other words, the virus would be far more widespread than we expected it to be, but also far less deadly than we expected. The actual death rate would not be 3 or 4%. It would be closer to 0.2%. That would be great. Now, we don't know for certain that's the case. 215 people is a small sample, and in this specific case, it's not a representative sample. Hospitals are major vectors for the transmission of coronavirus. Pregnant women tend to spend a lot of time in hospitals. Pregnant women are also younger and healthier than most people, so it's possible they're also less likely to exhibit symptoms of the virus. We don't know. On the other hand, this is not the only study that suggests these trends. In Scotland, researchers tested 500 people 3 weeks into the outbreak there. More than 1% tested positive for antibodies to coronavirus. That is 12 times greater than the confirmed caseload in that country at that time, 12 times more. In Denmark, a little over a month into the outbreak, only 0.1% of the population was infected, according to official numbers. And yet a screening of 1,500 people found that 2.7% actually had antibodies. That would mean the true death rate from coronavirus there might be 1/27th as high as they thought it was. Meanwhile, in Germany, the official death rate from the coronavirus stands today at about 2.5%. That's a horrifying number. And it may be real. On the other hand, in the town of Gangelt, where large-scale random testing has been performed, the death rate was found to be just 0.37%. That's a fraction of the official numbers, barely 1/7 of it. So all of this is very encouraging news. If the infection is more widespread than we thought, by definition, that means the virus is less deadly. That would mean our burden on the healthcare system would be lower than we expected it to be. And in fact, we are seeing that. It would also mean that coronavirus may be closer than we knew to running its course. It would mean an awful lot of people have already been infected with it and then recovered without even knowing it. And those people could pause and let relief sweep over them and then get back to their lives. Above all, if this is true, if these trends hold, it would mean that the rest of us could be slightly less terrified going forward. Yes, this is awful. Yes, people are dying. Yes, they will continue to die here in the U.S. But it would not quite be the plague we thought it was. And that might give us some perspective. We could begin maybe to think clearly again. Most of us want all of that badly. But do our leaders want that? Sometimes when you watch them, you begin to suspect they're secretly enjoying our fear.